Well, welcome to the show today, Dr. Ludlow. It's such a pleasure to have you.
Thank you. I'm glad to be here.
Great. Now, I understand that you are the founder of Seashore Pediatrics. Is that correct?
That's correct.
Well, tell me a little bit about that practice.
Okay, we've been here for about 10 years now. We started out in South Carolina in Norris and Little River, and over the last 2 years we've expanded to also cover Charlotte and Brunswick County.
And I think you're located right off of 17.
Yes, right in town off 17, right next to the Days Inn.
Oh, great. Well, that's a good
Yes.
landmark
Yes.
to give. And now I understand you have some partners. Who are your partners in the practice?
I have 4 associates, and the first is Dr. Michael Sanger. The second is Dr. Ramon Youssef. The fourth is Dr. Kenneth Richards, and most recently Dr. Fong Bu.
Wow. So you have several offices, is that correct? Or?
Yes, we have 3 offices right now. We have an office in Loris, South Carolina, and in Little River. We operate or associated with those offices with the McLeod Loris Seacoast Healthcare System. And then we have our newest office in Charlotte. As I said, we've been there for about 2 years, and we're associated with Brunswick Hospital.
Great. Well, I know we're happy to have you here in the area.
Well, thank you.
So tell me, how did you become a pediatrician? Let's talk a little bit about your education and your background, because I know yours is a little different.
Sure. I started my medical training in Philadelphia at Drexel University, and during my medical school years, you kind of decide what you want to go into. And I like general medicine, and I like challenges. I like to be involved with all body systems. And there was a choice between adults and pediatrics, and I just found that children are, it's just funner to deal with children.
Right.
Most of them do get better. They have a great attitude toward life. They're happy. They make me happy, and I just enjoy working with children.
Oh, that's great. One thing that's important to parents when choosing a pediatrician for sick visits, how does your office handle sick visits?
Well, my philosophy is that if you have a sick child, the child needs to be seen as soon as possible.
Great.
Parents are worried about their sick kids. So in my practice, the rule is, and my office staff knows that, if your child is sick and you call in before the office is closed and you can get there before the office is closed, you will be there, you will be seen that day.
Wow. That's a great philosophy.
And it works, and everybody's appreciative, and that's what we're there for. We're there to serve the community and to provide help where it's needed.
Yeah, it's been many years, but I can remember when my children were sick and waiting by that phone for that call back. And of course, they always got sick at night or on the weekend.
Right. Well, the other thing that we do, if your child does get sick at night, and they do, and on weekends,
they do.
You still call the office, and actually the pediatrician on call will talk with you and tell you what you can do until we can see them at the office.
Now that's pretty amazing.
Yeah, we try to keep the kids out of the emergency room if they're very seriously ill and we think it cannot wait for us to see them in the office. The following morning we'll send them to the emergency room.
Sure. But I love that philosophy of the sick children being seen now when they're sick. That's great. I know that you have well child waiting areas, and you have sick child waiting areas. Talk to me about that philosophy and how that all works in the scheme of, the office, how they get through and don't infect everybody else.
Sure. Well, as you know, pediatricians deal with sick children and well children.
Correct.
It's very important that we see children on a regular basis for well checkups to make sure that they're growing, developing appropriately, and to get their immunizations.
Right.
And you being a parent yourself, as you know, when you're bringing your well child into an office full of sick kids that are sneezing, coughing, and febrile, it's something that makes you feel very uneasy. So it occurred to me a long time ago that it didn't make sense to have all these well children in with the sick children. So we've separated our offices so that each office has a well area and a sick area, and we try not to intermingle that.
That's great. I wish that more primary care offices would develop that because I don't like to walk into an office and sit next to somebody who's sneezing and you can tell they're very sick. And you're not sick. You're just there for your allergy shot or whatever. So I think that is a great way to do it. Well, today I wanted to talk a little bit about allergies. I know I have them, and my children always had them, and still have them as adults. And I know it's this time of year. So, how do parents identify when their children have allergies versus a cold?
Okay. Well, there isn't a lot of overlap of symptoms, of course, but there are a few things that help distinguish. Number one, when a child is sick with a cold, often they'll not feel well. They may have a fever. They have other associated symptoms, and they just generally feel weak. With allergies, on the other hand, you generally feel pretty good. It's just that you feel like you're a dripping faucet.
Yeah.
Of course, the most common symptoms are itchy, watery eyes, stuffy nose, nasal congestion, continuously running nose, scratchy throat, sometimes a cough.
Yeah. Well, what about classic triggers for seasonal allergies? Are there some of those?
There are, of course. Pollens are the big ones. We have different seasons for different pollens. The trees start first, usually between February and May. Then come the grasses from about May to July, and then we have the weeds, of course, ragweed being the most common one toward the late summer, early fall, and the molds. Spores right there in the middle in the midsummer to early fall.
Pretty much all year round.
Pretty
There's
much,
something.
Pretty much. And those are seasonal allergies. Of course, you have the perennial allergies, which are the dust mite, the cockroach, the dog dander, things like that. And those symptoms tend to occur throughout the year, not just seasonally.
Well, if parents think that their children have allergies, what would you suggest what route should they take?
Well, if there's a question, first of all, usually there's a family history, often
Right.
there is, and they pretty much know if they've had allergies themselves. And at the earliest onset, of course, the mainstay you try to do is try to eliminate exposure as much as possible. If they're always getting allergy symptoms and you know when the grass is growing, then you try to keep them indoors as much as possible when the pollen count is high, and you can follow those on the internet or on the television.
Oh, that's true.
Yeah, early mornings and late and early evenings are probably the best time because the pollen counts are lower at that period of time. And then you now have some antihistamines over the counter that used to be prescription that are quite safe in children. One being loratadine or Claritin, the other being cetirizine or Zyrtec, and both are available for children 6 months and above.
So they should just talk with their physician.
Talk with their pediatrician or physician, and they'll advise you what to do.
Apart from seasonal allergies, there are other types of allergens, and I think we touched on that a little bit.
Right. You have the perennial allergens. Those are the ones that are in your home all year, such as dust mite, that's a big one. Cockroach is another one. You have, of course,
I didn't know you could be allergic to cockroaches.
Yeah, real common allergy, actually.
I
very
did not
common.
know that.
And of course, you know, cockroaches are everywhere. Everywhere that we don't
they call
want
them
to be.
palmetto bugs, I think, down here or something.
Yeah, they do. And they're big down here, too.
They're very big. I didn't even realize that you could be
Now,
allergic
with those
to
kinds
them.
of allergies, of course, because symptoms are all year long, you tend to, you know, no one wants to stay on medication all the time. And there are other, you know, prescription medications you can use. And then if medications don't help, that's where the allergist comes in, where you can do some specific allergy testing. And, you know, if you're allergic to everything and needing to be on medication all year long, then sometimes allergy vaccine or hyposensitization therapy is the way to go.
And what about food allergies?
Food allergies are, thank goodness, not as common as people think, but you hear a lot about food allergies. The most common ones.
I always hear milk.
Yeah, milk, eggs, soy, wheat, tree nuts like walnuts, peanuts, fish, and shellfish. Those are the big common culprits of food allergy. The danger with food allergy is that they have a tendency to be more severe and can be life-threatening at times. So it's something that if you think your child has, that's something that you should certainly see your physician for.
Well, it's been my pleasure to have you here today. It's been great information, very interesting. Are you taking new patients?
Oh, absolutely.
And how might they make appointments with you?
It's very easy. If you would just call the office at any point, it's 910-754-BABY. Baby meaning 2229. So 754-BABY.
754-BABY.
Yes.
Great. Well, thanks so much for being here today.
Thank you, Jane.
I look forward to seeing you again. We can talk about some other great topic of
I would love
children.
to. Thank you very much.
Thank you.
Thank you.